All right, thank you everybody for coming to attend the 2023 Psychonomic Society Diversity and Inclusion Symposium. I appreciate your patience. We're working on some technology, and the Psychonomic Society is my home society. I'm Jill Shelton. I've been a member of Psychonomics now for nearly 20 years, and I want to thank the Society for being intentional about bringing awareness to the issue of disability research. So DEIA initiatives, diversity, equity, inclusion, and access are of key importance to all of us. We're making a lot of progress. Society has really been working hard to make this happen and accommodate us. We still have a lot of work to do, and hopefully this session will help to inspire not only the Society, but we're hoping our colleagues will become invested in this issue. So for the last 20 years, when I present as Psychonomics, I'm presenting on topics such as attention and memory, decision-making, individual differences, all the usual suspects of cognitive psychology. And I've never really been intentional about discussing the issue of disability awareness in my research. And this is as a person who has lived with low vision blindness since adolescence. And so I'm hoping that I can motivate you to apply all of the expertise that you have and all of the topics I said, which can easily be applied to the disability community. We are the largest minority in the world. Nearly 20% of the population identifies as having a disability. So you really have an opportunity to conduct research and advocacy that will affect a lot of people. We've made a ton of progress in DEIA initiatives, but we have a long way to go in the scientific and academic workforce. So a recent report from the National Science Foundation really sheds light on the inequities that are placed on disabled scholars in our community. And so that's something that we all need to be aware of and need to be ambassadors to make sure that we're letting and empowering the disabled community. I'm really excited to get connected with this group of interdisciplinary scholars who are going to talk about not only their lived experience as people with disabilities, which is very important in informing our research, but they're going to integrate those personal stories with theoretical and empirical work that sheds light on the journey of things like disability identity, perceptions of the disabled community, factors that moderate those perceptions, the differences between populations such as the deaf and hard of hearing, blind population with compared to typically developing populations. We're going to talk about topics such as neurodiversity and ultimately about ways in which we can empower the disabled community and better integrate disabled scholars into our workforce. So just to give you a little information about how the session's going to run, we have 5 speakers who will speak each for 15 minutes. We're going to hold the question and answer session till the end. We're very fortunate to have Psychonomic VIP Morten Gernsbacher, who has agreed to not only moderate this session and keep us on time, which we know is important for Psychonomics, but also to kind of tie everything together at the end and highlight the themes of the goal of this symposium. And then hopefully at the end, we'll have time to have a productive discussion about disability research. So I'm going to get started here today. And are we on my title slide? Perceptions? Yes? Perceptions? Perfect. Okay, so I'm going to talk to you today about a topic that cognitive psychologists have been studying since the beginning, and that is perceptions. Now, we oftentimes are looking at the growth of perceptions in able-bodied people, but I really want to focus on perceptions that people have of the disability community. An outline of what I'm going to talk about today. First, I will discuss my journey as a disabled scholar from the beginning to where I am now, and I will integrate that with previous research people have conducted on how others perceive the disabled community. What are the factors that moderate those perceptions? And also, what can we do to minimize stigma, and promote positive attitudes about people with disabilities. And finally, I'll end with some preliminary data that I'm very excited about sharing with you, a new line of research that I've started in my lab about perceptions of disabled instructors. Here is a slide that I can say I have never shown at the Psychonomic Society conference, which is a picture, like my family likes to say, of baby dancing Jill. And so you wonder, why are we showing a child picture here? I wanted to illustrate the identity that I was forming. We know that starts forming very early in life. And so I did not have vision loss as a young child. As you can see in this picture, I'm dancing, I'm very happy. I still like to dance. I've lost the pigtails, but I still like to dance. So much of our identity maintains over our life, but there's also an evolution that happens, particularly when you experience a change in your ability. I grew up the first 13 years of my life in a small Midwestern farm town. I was happy, well-adjusted kid, liked to play sports, had friends, good social support. Always loved academics. I've always been a nerd. I was in math and science Olympiads, never missed school. This has always been a part of who I was. And something started to change in about the 6th grade. I noticed that I wasn't able to see as well anymore. I kept having to move closer to the chalkboard to be able to see. I was telling my teachers, I don't know what's happening. I did have a stigmatism that was unrelated to my ultimate genetic diagnosis, but I knew that something was happening, so they would take me to my small town local optometrist, and he would strengthen my prescription. Nothing was really working. In the meantime, I got no accommodations in the classroom because I didn't have a diagnosis. So that's a flaw in our educational system. Oftentimes, teachers would think, oh, she's just attention seeking, despite the fact that that had never been a characteristic of mine. Eventually, I went back to the local optometrist, and he said, I've done every test that I'm capable of doing. I can't physically diagnose Jill, but I believe what she's saying, and I think you need to take her somewhere where she can find some answers. Ended up going down the road to the big city medical facility. After 8 hours of testing, at this point I was 13 years old, the physician told my mom that based on his medical expertise, he could not find any physical reasons why I wasn't seeing. So clearly it was a psychological issue, that I had been traumatized into blindness. Nice thing to tell a mom of a 13-year-old. And so the medical community plays an integral role in empowering people with disabilities. So research from both the physician side and the client side suggests that physicians can oftentimes be stigmatizing, dismissive of people with disabilities, treat disabilities as if it's a homogenous group, when in fact there's a great deal of diversity in disability. So what clients are asking for, what patients are asking for, is for medical professionals to listen to them, to understand that they have a unique journey. Same with teachers. So many of you out there are teachers. You are in a role of power with your students. So I understand that we have a flaw in our education system where accommodations are supposed to be accompanied by a medical diagnosis, but you're creative and you can find ways to be accommodating to students. And what they're asking for is a safe space to have open dialogue about what they need, and they are asking for support that is reasonable. So my journey is very similar to other people who have a disability later in life. It may take a while for you to finally get a diagnosis. I was diagnosed with Stargardt's disease. That has evolved into a cone rod dystrophy. So even though you have an initial diagnosis of a disability, that's a journey and things can change over time. What we find is, particularly with disabled youth, a lot of this research on disability is from a developmental lens, and we're looking at what happens with children. Children with disabilities are significantly more likely to be bullied. They're significantly more likely to be excluded from both academic and play tasks in school. And so as peers, as teachers, we can do something to help promote positive attitudes about people with disabilities. hopefully I'm portraying the message that the perceptions that others have of people with disabilities is very impactful in the development of their identity. And we know that the establishment of a positive disability identity is critical for many positive outcomes of the disabled community. And other people really can impact this. There's a really great review that was published by Babbitt and Gardner in 2021 for anyone who's interested in this topic of how perceptions are formed. Again, as cognitive psychologists, we understand that how we perceive the world is a very complex process. It is a dynamic interaction between biological, sociocultural, and psychological factors. I don't have time to go through all of the topics that they covered in this study, but I'll just touch on a few that might be of interest to this audience. One factor that has been shown to moderate people's perceptions of the disabled is theory of mind, aka cognitive empathy. So a number of studies have demonstrated that children who have a more established theory of mind, so they're able to take other people's perspectives, they're open-minded about individual differences, those people are much less stigmatizing to people with disabilities. As I said, developmental lens has really been applied to this research, and so some of you out there may care a lot about development. And one thing is clear in this research that I've seen time and time again: parents play an integral role in helping to foster children who are good citizens. So for all of you parents out there, what's the best thing that you can do to ensure that you have a child that grows up to be open-minded and accepting of others? Be that yourself. Be a good role model. We know that children are going to follow your lead oftentimes. And so the parenting style, the way in which you empower your children to understand individual differences, to learn about how people are different, to be open-minded and appreciate the diversity they bring, can really change the way they perceive others. There's been some really interesting educational interventions that have been effective in promoting awareness and positive attitudes about disabilities, just like the cognitive training research. This is not going to happen overnight. It's going to take some time. So these educational interventions are most effective if they are more sustained and if parents and children engage in that education. We certainly know from a number of studies that the quality and quantity of contact with people with disabilities can help to minimize negative stigma. So think about ways to integrate people with disabilities in your life if you don't have a loved one. That can be really beneficial for not only for you, but for your children. Another way in which we can empower people with disabilities is by providing support, emotional support, structural support. There was an interesting study that came out recently that examined graduate students who were serving as instructors in their departments. They were disabled, and they asked these disabled graduate instructors, it's a qualitative study, so what are the barriers that you're facing? What can we do to make sure you're more successful? And what people are reporting is that the barriers they face are the fact that they don't feel comfortable asking for accommodations. So you could say that this may be about the individual needing to be assertive, but we have a culture, a structure, thank you, we have a structure in place that makes people feel wary of asking for accommodations. So being proactive in figuring out what they need can be really helpful. I have been fortunate to have both personal support from my parents along the way. Ever since my diagnosis, they never allowed me to use that as an excuse to not achieve my goals. They were open-minded that the fact that my journey may change to achieve my goals, but they still expected me to do that. My wonderful husband, who you see at these conferences, he's at least earned a honorary master's degree in psychology, sitting through this symposium, but he has changes his daily life to make sure that I have what I need to achieve my goals and doesn't make me feel like I'm a burden. That's the top left picture is Anthony and I at the top right. The bottom right is longtime psychonome Emily Elliott, who is my PhD advisor. She knew that I was legally blind whenever I applied to work in her lab. I was her first PhD student, and she could have been wary of that, and she wasn't. She never saw that as a barrier, and she made sure along the way that I had what I needed to be successful. So hopefully, we take the disabled person through their educational journey, then we take them into the workforce. Our colleagues in IO psychology have really brought awareness to the types of discrimination that disabled people face in the workforce. Employers say that they're concerned about hiring disabled people because they're going to be less skilled, they're not going to show up for work, accommodations are going to be too expensive, all unsubstantiated claims. In fact, research suggests that most employers report that disabled people show up as much, if not more, than their able-bodied counterparts. They're just as skilled, they're just as productive. Accommodations are, 70% of them are $500 or less. And even if you do have to pay money for those accommodations, what you're doing is not only empowering that individual, you are making your workforce more diversified and bringing unique, interesting perspectives that will lead to a more productive and inclusive workspace. An issue that I'm really interested in is how do people perceive minority instructors? Very minimal research in this area. Most of that has been focused on students' perceptions of the LGBT community, of Latino instructors, or the studies that I have found. In both cases, we see that students are believing that, for example, the LGBT instructors are more politically biased than their non-LGBT counterparts. So we're still seeing some biases in these students' perceptions. So my question is, how do students perceive disabled instructors? I haven't been able to find research in this area. So excited to tell you about a new line of research I'm starting in my lab. Data collection is ongoing, so all of this is still preliminary. We have 73 undergraduates from UT Chattanooga that we took from my psychology pool. You can see on the right there a pie chart that many of you have seen in your studies, which shows a mostly white female sample. There could not be more lack of diversity, and so we got to work on that, folks. One thing that we are doing in our demographics form, we're asking people if they have a disability. I'm guessing many of you don't ask that. I did not for a while, but I do now, so at least we can know the representation in our sample. We manipulated whether or not people listened to an instructor that looked like they had a disability versus not. That's our IV. Our dependent measure that I'm going to focus on today were two surveys, one of which that assessed people's perceptions of the lecture, another of which assessed the students' expectations for their own learning after watching the lecture. On the left here, you'll see a procedure, the illustration of our procedure. We randomly assign participants to the experimental condition or control. In the top right there, you'll see a picture of the video we used of the control. In the control condition, the instructor does not look like they have a disability. In the bottom right, the instructor has the visible signs of being blind, even though she's not. She has a cane and glasses. Students viewed a 15-minute video of a lecture on study strategies. Same lecture, same person, they just look different in the conditions. All done on Qualtrics online. At the end, they did a survey with a number of measures.
1 minute.
Thank you. Let's look at some data. So let me orient you to this graph. On the left here, we have average sum scores on the scale assessing perceptions of learning outcomes, so how much students thought they would learn after watching the lecture, scale of 0 to 25. On the right, we have average sum scores on the perceptions or the impressions of the lecture on a scale of 0 to 20. Orange bars are experimental, blue bars are control. Contrary to our predictions, we're seeing that students in the experimental condition exposed to the disabled or the what looked like a disabled instructor rated the lecture as more positive, significantly more positive. And there's even a trend for students in the experimental condition to say that they feel like they're going to learn more from the disabled instructor. Again, we have limitations in the study. Females tend to be less stigmatizing than males, and that's most of our sample. But at least there's a glimmer of hope here. In conclusion, I hope that I've been able to demonstrate that the disability identity journey is a complex journey that is very diverse. It's often impacted by the way in which other people perceive the disabled community. The good news is that there's things that all of us can do to help promote positive attitudes for the disabled community. So I encourage you to use your privilege, be ambassadors for the disability community, go out and think about how you can apply this in your own research, and certainly listen to your students, listen to your colleagues and loved ones when they're telling you they need support. So some acknowledgments here. My co-authors from the Cognitive Aging, Learning, and Memory Lab, that's how you can find me if you want to look me up. The Shelton Com Lab, we have Morgan Robinson, who was our lecturer, graduated from our Master's in Psych Science program, a shameless plug if you have students interested in a Master's in Psychological Science. Joe Carpenter in the middle there, who's a first year, identifies with the disability community. Amanda Leswing, and certainly to my university, who has always been supportive of me. Thank you.
Oh, thank you, Dr. Shelton. Our next presenter is Karen Arcos from the University of California, Santa Cruz, who will be telling us about discovering more about yourself through research and professional development.
No, yeah, but like, is the title slide showing?
Yes.
Okay.
Title slide. It's got more about yourself.
Okay, thank you. Good afternoon, everyone. Thank you for the opportunity for allowing me to speak with you all today. I'm pleased to share published results and evidence-based strategies for including marginalized groups in research, which includes people with disabilities. My unique experiences as a totally blind Latina since infancy have motivated my interest in how learning occurs internally. I use hearing, touch, and language to learn about my environment around me. So as you all can see on this slide, I have a picture of a 3D printed left hemisphere of a brain, which I used as a graduate student to be able to orient and understand the different brain areas and where the brain areas are in relation to one another. I'm particularly interested in increasing the number of underrepresented minorities pursuing science, given my intersectional identities. And I'm interested in how sensory modality affects our memory abilities. I also enjoy understanding more about the impacts of learning strategies and technology on our learning. By researching about evidence-based strategies, my goal is that findings may generalize to be applied in places such as university classrooms to create more inclusive learning experiences. First, I'll discuss some background, as well as research that I conducted as a graduate student on modality and socioeconomic status's roles in blind and sighted individuals' short-term and working memory abilities. This research has been published in Brain Research, and it was conducted under Doctors Emily Grossman and Susan Yockey. The study questions how socioeconomic status and encoding modality impact working memory performance in blind or sighted individuals. And finally, I'll discuss an initiative through the American Association for the Advancement of Science, or AAAS, that is shown to improve diversity in STEM fields. One population that particularly relies on working memory is individuals who are blind. Blind individuals use memory in daily life for tasks typically completed visually. So in my case, I might use my memory to be able to identify items such as identical yogurt containers. If they feel the same, they're both round, they're both the same height. How else would I tell them apart? Well, I might use the order of items to be able to distinguish one from the other. Another example might be navigating. So when I'm walking with my white cane, I will use a route to orient to my environment. So using left or right turns, using landmarks, and all of these rely on serial order. So I need to use order to keep track of information. And possibly due to the practice that blind individuals have with keeping information in serial order, blind individuals have been shown to exhibit a verbal memory advantage over sighted individuals. The differences are shown in individuals who are congenitally and early blind as compared to sighted individuals, depending on how working memory processes are evaluated. My goal is to understand how modalities such as visual, auditory, or tactile influence short-term and working memory while controlling for socioeconomic status. Modality has also been shown to impact short-term and working memory performance in sighted individuals. So in the case of sighted individuals, they've been shown to have greater visual short-term memory on auditory digit span tasks. When people are completing a digit span task, sighted individuals are shown to have higher performance when seeing the numbers as compared to when hearing the numbers, which leads to the question of whether differences between blind and sighted individuals are between group differences, or are they sense-specific, or are they generalizable to other senses? People diagnosed with sensory impairments like blindness are also more likely to come from lower socioeconomic status environments due to health inequalities. And by disentangling the role of modality and the influence of socioeconomic status, we might also clarify what factors other than blindness may explain the between-group findings. So to go into the methods, this study recruited congenitally and early blind adults as well as sighted adults. Participants were recruited through snowball sampling, and I'm happy to discuss more about sampling criteria after my talk. All participants completed forward and backward digit spans. In terms of the digit span, we considered the forward digit span as a short-term memory measure and the backward digit span as a working memory measure. The list ranged between 2 to 12 digits, and our dependent variable was trials correct. In terms of modalities, we collected auditory digit span performance in everyone while under blindfold. Sighted individuals also completed a visual version of the digit span task, while blind individuals completed a Braille version under blindfold. And the digit span task was the only task that tested for modality differences. We also measured working memory performance using an auditory end-back task. And I ask that you please refer to the paper for more details about the end-back task. Here are bar graphs for digit span results in our full sample of participants. And I also neglected to mention before that we also made a subset of blind and sighted participants matched for socioeconomic status, age, and education. This particular graph is focusing on the full sample, and it's showing bars for forward and backward digit span performance per modality. We find a significant effective group where blind individuals recalled significantly more digits as compared to sighted individuals when comparing them auditorily. In the case of modality differences, we ran a two-way repeated measures ANOVA using recall order and modality as our factors, and we find that in the case of sighted participants, They recalled significantly more visually as compared to auditorily, so we replicated that study. And we also find that the sighted recall significantly more in forward as compared to backward order. In the case of blind individuals, they recalled significantly more items when heard versus when read in Braille. They also recalled significantly more in forward as compared to backward order. And unlike in sighted participants, where we found no recall order by modality interaction, in the case of blind individuals, we did find a significant recall order by modality interaction when reading in Braille. And post hoc tests indicated that blind participants recalled more digits in forward as compared to reverse order when reading in Braille, but not when listening to the lists. So the significant post hoc tests for Braille, unlike for audition in blind participants, suggest that though Braille reading is beneficial in cases like self-guided exploration for items that are encoded, it might be significantly more taxing cognitively, at least in our case where the information was rapid and it was controlled, and Braille might have possibly had differences because Braille encoding is more spatial as compared to verbal. So the results suggest that short-term memory capacity is robust to the socioeconomic status factors that would otherwise adversely affect executive function. And I'll also note briefly that in the matched sample of blind and sighted participants, results were slightly higher. This experiment suggests that blind participants seem to have a selective auditory memory advantage over sighted participants. We find that there's greater short-term memory capacity in blind as compared to the sighted, which might be due to potentially blind individuals are recalling more items in ordinal positions. In the blind participants, we need to do that more often. And cognitive manipulation could also explain the lower performance on the Braille as compared to the auditory backward digit span task. And these results also suggest that carefully matching for socioeconomic status is important for clarifying the extent to which blindness adaptations could contribute to these group differences. And I'll note that a lot of studies prior to this did not take socioeconomic status into account. Enhanced memory on certain tasks might also reflect the importance of language for gaining information for those of us that lack vision, and the idea that language is an efficient tool for committing information to short-term and long-term memory.
5 minutes.
Thank you. Next, I'm going to switch gears to sharing steps that campuses can take to increase the number of people with disabilities in science spaces. So this pyramid shows different levels of programmatic changes that campuses can take in order to transform science, technology, engineering, mathematics, and medicine fields. So there's the idea of intervention programs, which are initiatives that are created in order to interrupt the status quo. So for example, something like a bridge program that is tailored for underrepresented undergraduates to help them get into graduate school. And most interventions focus on communities of underrepresented people, at least in STEM fields. A model for evolving intervention programs details a change from more isolated projects, which is shown on the pyramid's bottom level, to more structural transformation, which is shown on the pyramid's top level. In order to achieve true reform in higher education, institutional level commitments, which is shown on the pyramid's left, and funding, shown on the pyramid's right, is needed. And most programs tend to fall into more of the isolated projects or the department or school-based efforts. They rely on soft money and they lack the full institution's commitment. And usually a group of passionate individuals might create such programs, which leads to the question of, well, what if these programs run out of money? What if the director of these programs leaves the university? The programs tend not to be institutionalized at the time, and without building that capacity or changing the systems behind such efforts, the interventions are probably not going to be as effective in the long term. I invite you to read the AAAS's vision statement and one of its strategic goals that is focused on scientific excellence. This is where the AAAS's STEM Equity Achievement Initiative, or Sea Change Initiative, comes in. I again invite you to read the Sea Change mission and vision. By engaging in the steps outlined in the Sea Change vision, colleges and universities that are Sea Change members can begin to move their change needles. As shown in the Sea Change logo, there's 3 pillars that comprise the Sea Change membership. So Sea Change is made up of an institute which offers courses, trainings, and convenings on different research-based models to enhance how institutions approach their diversity, equity, and inclusion challenges. The institutions learn to use evidence-based strategies that address equity and inclusion barriers, prioritize using a needs assessment. The Sea Change community is a place where stakeholders can build partnerships as well as collaborate to open and nurture the STEM talent pool and share information, research, and best practices. The Sea Change Award is a recognition system where colleges and universities, as well as schools and departments, can be acknowledged for the work that they're doing on true institutional reform that supports diversity, equity, and inclusion. And these awards reflect a firm commitment to self-reflection and action, which enhances an institution's ability to attract and retain the best students, faculty, and staff. I'd like to take a moment to thank my co-authors, as well as research assistants, family, and outside organizations for contributing to my professional growth and research thus far. And you can see pictures on these slides of the many organizations that were involved in the research, as well as the Sea Change Initiative. I've shown pictures as well. Please feel free to contact me or Sea Change with any questions that you might have. And last, I'll take a moment to share my references and invite you to read the paper that I discussed, the Arcos, Yaki et al. Paper, which I've discussed that's in red. And thank you all.
Thank you so much, Dr. Arcos. Our next presenter is Rain G. Bosworth from Rochester Institute of Technology, and the topic is Are We Weirda? Ableist Sampling in Psychology Research.
Is the mic on? Okay, good. Hi, everyone. Thanks for having me here today. I'm Rain Bosworth, and I am from the Rochester Institute of Technology, RIT. So today, I'm going to talk, here, let me give you my outline actually on the slide. Today, I'm going to share very authentically from my heart my own personal journey and experience, as well as just talk about some of the barriers that I have faced, and to give those of you who don't face those same barriers a bit of a better understanding, and then talk about the research that has been happening and some current research in process of how we can improve our practices, and particularly in relation to our weird practices. I am profoundly deaf, presumably since I was born, but I wasn't actually diagnosed as deaf until I was 3.5 years old. And you can see I had one of those old school hearing aid systems, and I'm here in a class with other deaf kids. This audiogram on the right shows the speech banana, where the speech frequencies happen, and my hearing being well below that. I do benefit from hearing aids. I can hear some sounds, but I don't hear speech. I grew up knowing that my body was broken. And my hearing loss was something that needed to be fixed. My parents, of course, wanted whatever was best for me. They loved me. And the doctors told my parents, as they did at that time, don't sign, don't use any sign language, because if you use any sign language, then she won't speak. And if she can't speak, she's not going to be successful in life. We call those the dark ages of oralism in the deaf community, because it really was a time of complete oppression of sign language, where sign language was not allowed to be used. Deaf teachers were forbidden to even teach in classrooms. Deaf teachers couldn't teach deaf children. We literally did not have control over our own bodies during this time. I finally met another deaf person, as in a deaf signing person, when I was 15 years old. It was the first time. It was a whole new world for me, and I discovered my deafhood. Deafhood is the word that we use to talk about my sense of myself as a deaf person, and that as something to be proud of. I got my bachelor's and PhD in experimental psychology from the University of California, San Diego. And throughout my whole education, I was then relying on interpreters, which meant that literally I was learning the same language, learning my language that I had never learned before, because I didn't start until I was 15. I started learning sign language at 15, had to madly scramble to catch up linguistically, and on top of that, I had all of the content, the course content, in my undergrad and graduate work. But the interpreters did create an accessible environment, and I really developed my scientific interest in looking at the perceptions and the science of visual perception in both abled and disabled populations. I'm currently a professor, and I teach a wide range of psych courses to students who are deaf, students who are hearing, students who are hard of hearing, students who are deafblind, as well as deaf and disabled with other disabilities. I'm also the executive director of the Play Lab, which is the Perception, Language, and Attention in Youth Lab. So my college is the National Technical Institute for the Deaf, NTID. That's one of 9 colleges at RIT. Our college has just over 1,000 deaf students. In Rochester City is the largest population of deaf people nationwide. There's about 40,000 of us there, which means it's guaranteed that if you come to Rochester, you're gonna run into deaf people. And almost any hearing person who's in that city knows some sign language, and almost guaranteed knows some deaf people personally. So whether you go to a restaurant or you go into the emergency room, somebody there is gonna know some sign language. At RIT, we have over 200 interpreters and captionists. Just last year alone, we provided more than 91,000 hours of classroom interpreting. This picture is actually from the commencement. This is a deaf graduate, Surya. He received his master's degree last year and gave the commencement address. His commencement address was absolutely beautiful. And I show this here because it's a great example of access. There are interpreters, ASL interpreters, like we have today, watching him and delivering into spoken English. There's captioners listening to the interpreters and typing everything out to be captioned for people who need that. And then the second interpreter that you see over on the right there is using Indonesian Sign Language to interpret for Surya's family, who uses Indonesian Sign. RIT rocked education during the pandemic. We were way ahead of the game. And the reason is that deaf people have been using technology and hybridized education since the 1980s. We have video technology, video phones, captioning, texting was nothing new to us. RIT is also a hub for collaborative research between deaf folks and hearing folks, particularly around AI and accessibility technology. This really exemplifies the mantra, nothing about us without us. The reason I'm showing you this is to really give you an idea that inclusion, full inclusion is possible. The DEI initiatives that you're working on in your colleges and universities, they matter. I feel welcome. This is an environment in which I feel welcome. But now I'm going to back up and describe a completely different environment. This is actually one of my college classrooms. If I were to pick one, and there's plenty, but my biggest challenge in my professional career is not being able to go to conferences like this one, because they aren't interpreted regularly, and when I request interpreters, I'm regularly told no. But even if there are interpreters there, the challenges don't end there. So, for example, this shows a classroom, and this is a typical situation that happens all the time. So common, lecturers want to turn the lights off because they want to see the overhead better. But then I can't see. Through time, through my educational journey, I did become a better and better advocate for myself, but that's exhausting. Just one little example, in my grad school program, I was responsible to bring my interpreter's chair every day. I was sometimes involved in negotiating the price of the interpreters. After conferences that had hired interpreters, I would sometimes be chasing down the conference organizers, trying to get them to pay the interpreters because they weren't paying them. And it hasn't gotten better as a tenured professor because now I'm responsible for 3 grad students under me that I don't want to have to be limited by the same barriers that I was. So all of these barriers that I faced are inherent in structural bias. They're an inherent part of structural bias. I want to talk about microaggressions now. During my time in college, and this is a very common experience, the professor would actually text the interpreter and make a joke out of it. Like talk as fast as they possibly could and then look over and see, did you catch that? And then the whole class laughs. That's just one example. When I was in a PhD, I was actually moderating my first conference, much like this one. And I looked over at 2 other speakers on the panel there. And this one speaker said out loud, right in front of me, "Oh, no, Rain won't be able to moderate this. She's deaf." Another example happened a few years ago when someone asked me to be a keynote presenter at a conference. And I accepted. The conference was being organized well in advance, like a year prior. And then about a week prior to the conference, I looked at the program, and there were all these speakers lined up, and my name was strangely missing. I contacted the conference organizers, and they said, "Oh, sorry, we didn't have the funding for an interpreter, so we just took you off the list." And they hadn't even told me until a week before the conference. The last story, one time I was actually sitting on a train. This wasn't a work thing, but just a personal experience that I had. All of a sudden, a note gets dropped in my lap from a stranger on the bus, and I'm going to have the interpreter just read it out loud. It said, "You really should be more aware of flailing your arms in someone's face on the train. Not pleasant. So I stood." Those kinds of experiences tell me I'm not welcome here. And really, we're talking about two different types of structural bias, ableism and autism, meaning being deaf is not good enough. It's less than. It's broken. Meaning able-bodied is better than. So in this last part of the lecture, I'm going to talk a little bit about weird practices. Our weird practices, I'm sure we're all familiar with the acronym WEIRD. It's used sort of as a catch-all to talk about how we tend to sample white, English-speaking, college-educated sampling. That's who our samples tend to come from. And we've been talking about this for the last 15 years. It's been a thing. And the research shows that the numbers have not gotten any better, even with all the discussion about it. And that people with disabilities are systematically excluded from research, even though that literally is representing comprises approximately 25% of the population of the US. So there was a recent study that looked at 100 protocols posted on clinicaltrials.gov, and they looked specifically at their inclusion versus exclusion criteria. This is what they found. That there's basically broad rights given to investigators for any reason not related to safety to exclude people with disabilities. The PI basically has the right to exclude anyone for all of these reasons posted here on the slide. Only 18% were permitted people with disabilities to participate in the study and provided some accommodations to do so. So if there's no explicit ethical reason to exclude and there's no scientific reason to exclude, we're talking about discrimination, pure and simple. So this last part is some basic statistics that you all should be familiar with. Let's say that we, these are basic ways that we measure things. Let's say we've created an assessment tool to assess some cognitive function, memory or perception or learning or something. And then we create a normal curve to see how people are relative to each other, how their performance is relative to each other. But my question for you is, who's making these assessment tools? Could it be the same people who turn off the lights when a deaf person is sitting in their classroom? Could it be the same doctors who decide who's in and who's out? Maybe it's the same people who decide that spoken English is the way to go and we should do away with sign language. We already know that most scientists, well-established scientists, are white, able-bodied male. So now, if they're the ones who've created the tests, and we give the test to a non-weird group, the results are obviously not going to follow their normal curve, which ends up being a way that then disabled people get labeled as deviant and then further excluded. Of course, their performance is deviated from the quote norm because their language and their experience have been so profoundly distinct from the test creators' language and experience. I want to acknowledge a beautiful statement expressed by Drs. Henner and Robinson, two deaf scientists, who basically highlight the ableist and discriminatory implications because they say that the normal distribution is not neutral. Last but not least, the microaggressions that I experience, the discrimination, is inseparable from the weird practices, sampling practices that we use. And I'm going to repeat that. My stories, the microaggressions that I've experienced, and those discriminatory sampling practices come from the same exact bias. It's the same ableism bias in different forms. Oh, and I forgot, I got to back up here. This picture right here. I want to just say a little bit about this picture. So it's a picture of a deaf baby smiling, and the quote, the caption says, "Say no to sign language." So you got to do your homework to even know why this is here. These are some of the ableist practices that hurt deaf and disabled children. And if not hurting people and not hurting children is not enough motivation for you, I'll bring it real close to home and tell you how exclusion makes your science bad. Your studies are not replicable, they're not robust, they don't stand up to critique, they're biased, and they contribute to greater public mistrust in science. I'm going to conclude today with a quote from my favorite deaf scholar, Dr. Carol Padden, and I'll just have the interpreter read it off the slide. "How do deaf people speak in the time of the microchip and the genome? We find it hard to be heard in the public discussion about prostheses and genetic engineering." We're afraid for ourselves. We're afraid for our community. We're afraid for our bodies not having a right to exist in the future. And this is a problem that I share with my other disabled colleagues as well. We wonder, how will science use us, or possibly ignore us, or harm us? Or will you use us to actually inform better scientific decision-making about humanity? Thank you.
Our next presenter is Teresa Blankmeyer Burke from Gallaudet University, and the topic is Strategic Advocacy, Individuals and Institutions.
Hello, everyone. Can those who need to see me okay? I am so grateful to be invited to come and give this presentation today. It's exciting. I want to share both my personal experience as well as that in my work with the American Psychological Association, Philosophers Association, the APA, the other APA. My topic is strategic advocacy for both individuals and institutions. Who am I? I have family roles. I'm a mother, a daughter, a sister, an aunt. And I have been an advocate since my high school days for people with disabilities. The words that I choose to describe myself may be hard of hearing or deaf. The aspects of our identity rely on level of hearing loss and ability to speak. And so I can jump back and forth between both worlds. And I am also a bioethicist, and I study genetic ethics. My undergraduate work was at Mills College in philosophy. I grew up in a family that had 3 different spoken languages, my extended family: Spanish, Arabic, and English. But my language, I was bilingual, and at the time, sign language was not permitted. The doctor told my mom that we needed to choose one language and stick with it, and it was English. And over time, I picked up Spanish from associating with family members, playing with my cousins, so it was a very natural progression. I want to talk about one big challenge, a problem that refers to perception or perspective. most accommodations don't cost as much as people would assume. But interpreters and captionists do cost money. One of the problems that we have is institutional infrastructures are not in place to provide services like interpreters and captionists. Interpreter selection and scheduling is not an easy process. Frequently, you'll have a group of interpreters, for example, here in San Francisco, 4 or 5 that will come to the presentations about philosophy. But as far as being able to select interpreters who have appropriate register, who know the vocabulary of the field, and are able to handle the attention process is difficult. And sometimes I have to work with my interpreters to get a language established that we can have in common to be able to present well. So how do the highly educated individuals contribute to finding interpreters, discovering mechanisms for funding in higher education, and using those resources to develop opportunities for people with disabilities? All of these are challenges. So I was thinking, for example, the cost of interpreters, but what about additional costs for personal care assistance? The work that has to be done to get the interpreters scheduled and procured. What is the law? What are the requirements that have to happen? There's an emotional impact in answering all these questions, making sure that my rights are attended to and not marginalized. And if I can't answer these questions, often I have just withdrawn. I have not participated. And so that is a loss in terms of my scholarship and my scholarly advancement. One question that we often are forced to address is what language is going to be the preferred language. So in contemplating strategic advocacy, we have to consider the cost. What's the best approach for the deaf scholar who wants to stay in the field? Secondly, how is it possible to reduce or eliminate balancing cost with advocacy, with needs? I want to save the time for research. At the same time, I have to go and spend additional resources to do advocacy efforts. And what about people being labeled a troublemaker early in their career? I had that happen to me. So let me give you a little bit about my grad school experience. First of all, I was looking around for other deaf philosophers, and there weren't any. I may have been arrogant in thinking I could do this work alone, but I'm working with deaf and hard of hearing social services, and I'm a little bit stubborn. So I was determined. I had to figure out, was I going to hide my disability, or I was going to be an overt deaf or hard of hearing signing person? It was essential for me to figure out how to keep my identity, whether to keep it hidden, and what was I going to write my dissertation about? I also had to figure out how to manage the perception of other graduates as they were dealing with me and my privilege, their perception of my privilege, that I would have more time with the professor because I had to figure out what was going on. But it was more about the advocacy time rather than being able to actually do my work. And in the end, I had to determine if I was going to come out of the closet, basically, disclose my identity. So time went on, and the university hired me. Gallaudet University is a deaf and hard of hearing institution, or an institution that accepts deaf and hard of hearing students. And they have interpreters, they have captionists as a part of the institutional infrastructure. So I'm teaching in ASL with English slides like I have here today. But I look back and I wonder if we were actually successful. I feel a little bit guilty because now that I'm tenured, I can speak. So I have, my classes are more protected, more guaranteed. I have privileges. And I look around at my colleagues and I wonder who has left the university, who has stayed, who has attained tenure, who has not, who has quit before they could get to that point. Do other disability communities have colleagues that are in the same situation? Have they become full professors, and where are they? There are not many. I'm the only one that I know of in philosophy.
So, trying on my hard of hearing identity. Can you hear me? Yeah? Okay, great. Thank you for the visual. So I decided to shift my career from working in research and bioethics and genetics to becoming an advocate strategically with different institutions. And I have a long-standing association with the American Philosophical Association doing disability advocacy. I'm currently the president of the Society for Philosophy and Disability. So one of the things we did in 2018 was we conducted a philosophy disability climate survey. We made it available by email to all APA members, and this was, again, in 2018, before the pandemic. We got 467 responses, including about 33 pages of written comments. One question we asked was, are you a person with a disability? And 32% of people said yes, they were. We also asked about types of disabilities. So we had, thank you, we had a smaller percentage of sensory disabilities and then the physical disabilities. But the largest percentage, about half, were people with mental disabilities. And we asked the question of whether barriers or burdens occasioned by disabilities, your own, a family member, or someone else, disadvantaged you in your philosophical research, communication, teaching, service, travel, or study. And we had 37 say yes. And then when we asked them if they were aware of barriers or burdens occasioned by disability to someone other than you in philosophical research, communication, teaching, service, travel, or study. I'm reading the slide. 62% said yes. And I think maybe that might reflect the vociferous, ruckus-causing advocacy of some of us in the APA. And I like that. All right, so what did we learn? Well, we learned that if one issue was participating in conferences. Conference venues are inaccessible, small crowded rooms and walkways are difficult for people with mobility disabilities to navigate, cumbersome wheelchair accessible routes, so rather than going from point A to point B, you might have to go all the way down to get the elevator, go up, and then come all the way back, and that takes a little more time. Navigating among all the different venues, from hotels to restaurants to airports, and just trying to figure out how do you manage to do this and stay within the constraints of the conference schedule. Lack of childcare for people who have children with certain kinds of disabilities, and limited accommodations at conferences, such as sign language interpreters, difficulty changing which talks you want to go to during conferences if someone else has made the interpreter schedule. Sharing interpreters is another one. participating in presentations. Handouts and PowerPoint presentations are not always accessible. People who have hearing impairments, and by that I mean people who don't know sign language, might have difficulty hearing the presentation if the microphone is not present. Sign language interpreting may have difficulty if the lighting in the room is not great. And I have to say here, this is a challenging environment for me with the lighting. Standard practices for Q&A, raising hands, etc., disadvantage some people with visual, hearing, psychiatric, or cognitive disabilities. And then the last was sustained attention. Presenting. Speaking slowly and going over the time limit. I timed my presentation a couple times. How much do I sign? How much do I speak? I think I kind of hit the magic number, but I'm not sure. Takes longer because you're waiting for the interpretation. Stuttering, chronic pain, having to remain seated or standing for long periods, and then sharing sessions when the person has a hearing or visual impairment. Travel. The prioritization of physical presence at conferences. Again, this survey was done prior to the pandemic, so I'd be very curious to see if that shifted a little bit. Travel can be more expensive for people with disabilities, and airlines are infamous for damaging assistive devices such as wheelchairs. How about networking? Communication can be hard in noisy environments, if the visual cues are something that you're trying to figure out and the lighting's not good, if you have difficulty speaking. Inaccessible social occasions, difficulty standing, holding a plate and a drink. If I'm holding a plate and a drink, I can't sign. It makes it a little challenging. Late hours, overstimulation. In philosophy, we have this famous ethics conference that we refer to as Rome Rocky Mountain Ethics Conference, and it has hikes planned every day. If you are a person with a mobility disability or another disability who cannot participate in the hikes, you are excluded from that part of the conference. Joining or staying with informal groups, such as informal dinners. If you have booked interpreters for the events, the formal events of the conference, but the conference organizers do not believe that you should have access to the informal events, then you're excluded from that opportunity to network and learn and work with your colleagues. Social anxiety is another thing that came up in our study. Accessibility issues in accessing materials for your research, conducting research, teaching, learning in classroom settings, pursuing graduate programs. This was a big one and continues to be a struggle for the APA philosophers. And navigating campuses, searching for and securing jobs. Again, back to this question of, do I disclose I have a disability? If I do, when do I do it? Some people are able to pass as able-bodied. Not everyone is. Caring for disabled family members. So what are some of the effects of these burdens and barriers? One is leaving the profession. I can't tell you how many times I was ready to quit, but it's easily in the double digits. Another is not fully participating in our activities. I will say, and this is not to shame or blame, because I'm very glad everyone is here. I'm glad to be part of the conversation and working on and with the Psychonomic Society for improving accessibility. But for me, the experience of having a remote interpreter is not something that makes my conference experience positive or makes me feel very welcome. I guess it's better than none, but we can talk about that later. And then, thank you. And then last is people hide their disabilities and don't ask for accommodations. And that may mean that people can't do as well as they could. So that's a significant cost. Some lessons. Identifying and breaking certain old habits about how we normally do things in our classes and meetings. We have to have these conversations. Finding ways to keep in mind or remind ourselves of our duties to provide necessary accommodations. creating backup plans for times where we forget to provide the necessary accommodations or you have to work on something on the fly. And I think this is a great example, the way this committee came together. We didn't, none of us knew all of us. And we somehow pulled it together and figured out it's very challenging to put together a panel that has blind and deaf and people with different disabilities in one context and make sure that everyone has the accommodations needed. It's really hard. So I want to end by saying that disability advocacy and scholarship go hand in hand. Increasing the representation of disability scholarship in conferences brings attention to issues of disability, and I'm so glad that you're doing this here today. It also shows respect for those of us who are affected by them. It adds new and valuable perspectives, and it helps combat prejudices against disability scholarship and disabled people ourselves. Thank you.
Thank you so much, Dr. Burke. Our next presenter is Dr. Stephen Capp from the University of Portsmouth, UK, and his presentation is Autistic Identity Across Development, a Critique of Regression into and Outgrowing Autism.
Thank you. So this presentation introduces a couple of my manuscripts that are in preparation, one on a critique of, as Morden said, regressing into autism, and also one on a critique of losing one's autism diagnosis or outgrowing autism, so to speak. And together, these ideas are compatible with the principles of the neurodiversity movement, which I study and participate in as an autistic autism researcher. So I will introduce, or I will explain neurodiversity as a concept, a framework, and a movement based on a synthesis of research and scholarship, most of which I've contributed to. So neurodiversity, as I said, it's both a concept, a framework, and a movement, and these are kind of, these quotes are based on data from a study that we published. The paper didn't actually include these quotes, but it was about people describing neurodiversity in their own words, autistic and non-autistic people. And so it was from the same data set and study. And so there's a sort of an arguable fact of neurocognitive differences, although what is a sort of a biological fact or not is in dispute, whether anyone is actually neurotypical, if there's such a thing as a typical brain. But it would be, the quote here is, variations in brain function that lead to differences in perception and bodily experience. And I'm consciously choosing to actually read my quotes to be inclusive, because sometimes I don't, and I assume that people in the audience can read while I present, but that is an implicit ableist assumption. And even though I know that there are various differences in perception and neurodiversity, and 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 the scope of neurodiversity actually is arguably it includes everyone. So this variation that I spoke of, there wouldn't be a group that would hypothetically just be autistic people who hypothetically, again, do not have other differences and disabilities, would not be neurodiverse. The diversity comes from the differences in neurotypes. So arguably, various other disabilities that are somehow related to the brain are also neurodivergences. And a neurodivergence would be a neurocognitive difference that significantly differs from the supposedly neurotypical majority. As I said, we can be critical about whether anyone is neurotypical, but and the neurodiversity framework values these differences. So the quote is acceptance of neurotypical people like people with autism or depression or schizophrenia. And the neurodiversity movement adopts the neurodiversity framework in advocating for the rights of the neurodivergent. And the quote is an advocacy movement for people with neurological disabilities based on acceptance and rights. And I edited a book called Autistic Community and the Neurodiversity Movement, Stories from the Front Line, that is available for free online and for print, but the profits don't even go to me, ha ha ha. And also most people seem to just prefer to read it online, which is totally fine. And so the quote from Dora Raymaker, who is an autistic academic and a co-founder and co-director of the world's kind of maybe first community-based participatory research autism group, ASPIRE, the Academic Autism Spectrum Partnership in Research and Education, which they co-founded in, I believe, with Christina Nicolaitis in 2006, and I've been part of since 2011. So the quote is, neurodiversity to me means both a fabulous celebration of all kinds of individual minds and a serious, holistic acknowledgement of the necessity of diversity in order for society to survive, thrive, and innovate. It means identity, belonging, and community. It means I am not broken, not alone, and neither are my siblings standing with me beneath that huge multicolored neurodiversity umbrella. We, the autistic, the mad, the weirdly wired, the queer, the crippled, and the labeled with neurodivergent diagnoses like flowers that glorify our beautiful bodies and minds. So, so the research on becoming aware of neurodiversity and autism indicates that autistic people and people aware of the neurodiversity movement are more likely to have views aligned with it, autism as a positive identity that does not need a cure, but also that has some challenges that are not entirely caused by an oppressive society, and for which people may support means of ameliorating. So they may have some inherent aspects as well. And so learning about neurodiversity, having a perspective that's aligned with neurodiversity improves autistic adults' self-esteem and helps them identify with other autistic people. And other research indicates that autistic people often feel more comfortable on average with other autistic people, sometimes understand fellow autistic people better, although they're obviously autistic people are a diverse group and there are exceptions. And becoming aware of autism through proactive, nuanced parental disclosure helps autistic adolescents form a more positive identity. So this is another study I co-authored. And in that study, none of the participants in which, and whose parents involuntarily or did not disclose autism to them described autism in nuanced, let alone positive terms. And I feel, it could be relevant to say that my mother did voluntarily disclose when I was basically aware of why I was brought to the clinic. When I became diagnosed on the autism spectrum at age 13, and she said that I was wired differently, without being aware of the neurodiversity movement, which was young at the time in the 90s, because the first usage of the term that we really of neurological diversity that we're aware of goes back to 1996, and this was 1999. So becoming aware of an autism diagnosis earlier is associated with more well-being and higher quality of life. And that's something I could discuss further if you're interested. But I co-authored the first study on that. And thank you. So, So autistic people are more likely to view autism as natural, and this goes back to this idea of autism as a lifelong difference and disability, importantly, regardless of awareness of the neurodiversity movement, more likely than non-autistic people to view it this way. And the neurodiversity movement, of course, does value the experiential expertise, lived experience in autistic people, but also autistic adults. In a study that I co-led had the most knowledge of autism, and higher knowledge of autism was related to lower stigma toward autistic people, and it was related. The higher knowledge came from items that were about relative capacities and strengths in autistic people. Next slide. Or I think I actually have the ability to do that. Okay. So to really quickly summarize somewhat complex papers, so autistic regression, so it's a concept, well, we know that autism isn't able to be diagnosed until toddlerhood, and that the DSM is entirely deficit-based, but the autistic people do tend to have some complex differences, including strengths that can ironically pose challenges. And so it's true that some autistic people do lose language, and that's where part of it comes from, although language per se itself isn't necessarily part of the diagnostic criteria anymore. But it's usually more of a slowdown or even regained in early childhood. But part of this comes from this idea of autism as being an inherently social and communicative phenomenon, when the earliest differences are sensory, attention-based, with general attention, and motor, related to, children who are later diagnosed with autism. And parents have had some difficulties reporting, the onset, and especially of reporting on sensory processing, which inherently is internal and can only be experienced directly by the autistic person, have had special difficulty reporting on that. And so we also know that infants who make at if they actually make more eye contact than other infants, they're actually more likely to be, it actually predicts an autism diagnosis, ironically, and you could see some of these ironies, understand it through this complexity of, the sensory movement perspective of autism, and I can go into more detail about that, but I'm running out of time. And so, and then the critique of outgrowing autism is basically about that we know autistic people's functioning tends to fluctuate and that it varies by social context, and we even helped get language into the DSM-5 about that and about how the severity scale should be reframed as about need for support, and we wouldn't want people's support taken away because they're doing well. And so some people learn to camouflage, which is actually hide their autism overtly in some contexts, but that's actually linked to worse mental health and suicidality, and actually people who no longer meet criteria, and I can talk about this more, current behavior, actually, their neurological functioning relates more to their early childhood behavior, which shows how people are forced to really change their behavior. And again, and these neurological differences themselves precede the behavioral differences, but autism, again, is diagnosed by behavior. And so this goes back to the importance of the brain and how autistic people often emphasize an internal definition of autism when asked to describe autism in their own words compared to non-autistic people. And again, only autistic people have direct access to this lived experience. And so again, I can answer any more questions, but thank you very much.
Oh, thank you so much, Dr. Kapp. Greetings, everyone. I am Morten Gernsbacher. I am a Vilas Research Professor and the Sir Frederick Bartlett Professor at the University of Wisconsin-Madison. I'm also a past member of the Psychonomic Society Governing Board, a current member of the Psychonomic Society's Carbon Neutrality Task Force, and a recent recipient of the Psychonomic Society's Clifford T. Morgan Leadership Award. But above all, I am incredibly honored to serve here today as a discussant with this amazing panel. We have just held witness to 5 diverse scientists, each of whom has shared their perspective on disability, identity, and research. As we learned today from Dr. Shelton, disability identity is a deeply personal and multifaceted concept that encompasses recognizing and accepting one's disability as an integral part of one's identity. Understanding disability identity means understanding how an individual's disability shapes their perception, their cognition, their attention, their judgment, and decision-making. In other words, everything that we psychonomes care about. As we learned today from Dr. Kapp, some non-disabled researchers are working with shaky empirical motivation to erode disability identity, which is unfortunate because acceptance of disability identity yields empirically established benefits. For example, I've previously reported about a large-scale study of nearly 1,300 people in the U.S. with a wide range of various disabilities that demonstrates that disabled people's acceptance of their identity as a disabled person is highly and positively correlated with their self-esteem. The more a person accepts their disability, the more positive their self-esteem. And this strong positive relation between acceptance of disability and self-esteem is independent of the person's gender and race, level of education, and marital status. It's only weakly a function of whether the person has multiple disabilities or just one. I've also previously reported about studies that demonstrate a related positive effect, that people who accept their disabilities have better psychological well-being, as demonstrated in a US study of nearly 120 polio survivors, and a Belgian study of nearly 100 individuals with chronic fatigue syndrome. And a Dutch study of nearly 600 people with spinal cord injury also demonstrates a strong positive correlation between acceptance of disability and psychological well-being. And this Dutch study, as well as a Thai study and an Australian study with people with acquired brain injury, also illustrates another important principle, and that is that acceptance of disability is frequently independent of severity of disability. That there are people with, for example, severe spinal cord or brain injury who fully accept their disability and reap those positive benefits of acceptance, and then there are people with much milder injury who resist accepting their disability, and therefore they miss out on those benefits of disability acceptance. Independence between acceptance of disability and severity of disability has also been shown in a Polish study of 115 people with chronic lower back pain, a US study of 50 people with pain from a spinal cord injury. And multiple studies also demonstrate the quality of life for people with disabilities is also independent of the severity of the person's disabilities. For example, a British study of nearly 50 adults who were disabled by prenatal exposure to thalidomide demonstrates that their quality of life is independent of the severity of their disability. And I really like this British study because the severity of disability was precisely and objectively determined because of the long-term financial compensation provided by the UK Thalidomide Trust. But in this study, there were individuals with severe levels of impairment due to their exposure to thalidomide, as well as individuals with only minor levels of impairment, and it didn't matter. And that is the power of accepting disability identity. As we learned today from Dr. Arcos, when disabled people accept their disability identity, they can also connect with the community. And Dr. Arcos attested to the importance of intersectionality and diversity in those communities, including disability communities. Only by incorporating in diversity in disability communities can a sense of real belonging and true empowerment be fostered. As we learned from all of our presenters today, and in particular Dr. Bosworth, inclusion of disabled people in all aspects of research, from conception to design to analysis to reporting, is crucial. Some of you might remember from my 2007 APS presidential column, which I titled "The True Meaning of Research Participation," I take quite seriously the disability rights mantra that nothing about us without us. I don't believe that research should simply be conducted on disabled people. It should always be conducted with disabled people, and with disabled people leading the way in terms of what to study and why. I imagine that many of the problematic aspects that Dr. Kapp shared with us today and the research he critiqued would have been avoided if those non-autistic researchers would have collaborated with autistic people and prioritized autistic people's input and perspective. When societies, including society at large and our proximal society, the Psychonomic Society, acknowledge and value disability inclusion, societies can promote a more diverse worldview. As the United Nations reminds us, respect for difference and acceptance of people with disabilities is part of human diversity and humanity. As we learned today from Dr. Burke, accommodation is key to inclusion and accessibility. And the power of accommodation is illustrated by a behavior genetics study of a pair of identical twins who were raised apart. That is, through adoption, each twin was raised in a different family. When one of the adoptive mothers was asked if her adopted child was a picky eater, The mother responded with frustration and consternation and exasperation, saying something like, "Oh my goodness, yes, she is such a picky eater. She won't eat anything unless I put cinnamon on it. She wants to have cinnamon on everything she eats. It's bizarre, and it tries my patience on a daily basis." When the adoptive mother of this child's identical co-twin was asked the same question about her adopted daughter's eating habits, she responded calmly and evenly with a response such as, "No, she's not a very picky eater at all. I think she's a great little eater with a super healthy appetite. I bet you she'd eat just about anything. Well, as long as I put cinnamon on it." The cinnamon anecdote illustrates the heart and soul of the concept of accommodation. And I think it's easy for many of us to become too passive about disabled people's needs for accommodations because, in essence, those are their human rights. I think it's easy because there are accommodations such as curb cuts, which were initially established to level the playing ground, literally level the playing ground for one minority group, namely people with mobility disabilities. But in reality, although curb cuts have been incredibly vital for improving the mobility of wheelchair users and scooter users, take a look at any street corner all around the country, and you'll see that the overwhelmingly vast majority of people who benefit from curb cuts are not necessarily people with mobility disabilities. Rather, most people who benefit from curb cuts are people riding bicycles, people pushing strollers, dollies, and most relevant to this weekend, people pushing or pulling rollerboard suitcases. Similarly, closed captions have been incredibly vital for improving access to entertainment and education for deaf and hard of hearing people, but most people who benefit from closed captions are not deaf and hard of hearing. Rather, most people who benefit from captions are hearing people, and not just hearing people at bars or airports or in work cubicles who want to watch YouTube without getting caught by their boss. As my own research illustrates, captions increase literacy skills for hearing children learning to read. Captions increase language comprehension skills for hearing people learning a second language. And captions increase memory for hearing people of all ages, including most notably we boomers. As Dr. Bosworth reminded us, like curb cuts and captions, video conferencing was invented to aid the deaf community. And regardless of our love-hate affair with Zoom, I think few of us hearing people could imagine having gone through the pandemic without it. And therein lies the rub, because non-disabled people have adopted many accommodations initially invented for disabled people. Non-disabled people have a tendency to think of those accommodations as mere conveniences, like curb cuts or escalators or elevators. But for disabled people, accommodations are more than just conveniences or niceties. They are vital for disabled people's success and their access. And all of us need to be vigilant in ensuring that access is always available if we want to be good allies. In sum, our aim today has been to encourage our colleagues in the Psychonomic Society to become more informed and more active in championing disability research, equity, inclusion, and accessibility. So thank you all for your attention today. I'd like for us to all give a hearty round of applause to our presenters.